It is incredible how modern technology allows us to connect with healthcare professionals from the comfort of our homes, offering quick advice and initial assessments. But have you ever wondered if a virtual chat is truly enough for every health concern? After a telehealth call, you absolutely need an in-person exam when your condition requires a physical assessment or a diagnostic test that cannot be performed remotely. Telehealth is fantastic for initial consultations, medication refills, or discussing test results, but it has inherent limitations when it comes to hands-on examination. The primary reason for needing an in-person follow-up stems from the very nature of a physical examination. A doctor relies on their senses of touch, sight, and hearing to gather crucial diagnostic information. Telehealth, while allowing for visual inspection and verbal communication, cannot replicate the detailed assessment achieved through palpation, listening to heart and lung sounds with a stethoscope, or collecting samples for laboratory testing. These limitations mean that a definitive diagnosis or assessment of certain conditions often requires direct physical contact and specialized equipment. So, how do you know when to make that in-person appointment? You should seek a hands-on exam if your telehealth provider recommends it, or if you are experiencing symptoms such as unexplained pain, visible rashes, unusual discharge, or any issue requiring a swab, a blood draw, or other direct sample collection. These are situations where the visual and verbal information alone might not be sufficient for an accurate diagnosis or to guide the best course of treatment. Understanding these nuances is key. Healthcare professionals use their clinical judgment to determine if a condition warrants a physical follow-up, always prioritizing your safety and the accuracy of your care. They are trained to identify red flags during a telehealth session that indicate a need for further investigation beyond what a screen can provide. This collaborative approach ensures you receive the most appropriate and effective care. Ultimately, recognizing when to transition from a virtual chat to a direct visit ensures you receive a comprehensive diagnosis and the best possible treatment plan. It is about leveraging the convenience of telehealth for what it does best, while also knowing when to seek the full scope of medical assessment that only an in-person exam can offer, helping you maintain optimal sexual health with confidence and clarity.